the body temperature can be recorded. So the sites for the temperature recording, these are mouth, axilla, rectum, then lower 1/3 of esophagus, and tympanic membrane, and of course the skin temperature that is taken from the skin. But we are more concerned with the temperature of brain. You see, the rectal temperature, that is not the same as the temperature in the brain, where the temperature is regulated. So there comes the importance of the tympanic temperature, which is a good estimate of the actual brain temperature. Now, for recording temperature, there are several devices which are used. For example, the mercury thermometers, which you are familiar with. Then come the thermocouples and the thermistors. And there are also ingestible core temperature pills. Now, how do these pills work? They actually use low power radio frequency transmissions to communicate with the temperature monitor. Well, as far as the classification of temperatures is concerned, temperatures can be classified from very cold to very hot, varying between from very cold to cold, and then it becomes cool, and then there is a range where the temperature becomes neutral, and then it rises up to warm and hot and very hot. We call the temperature very hot when it reaches beyond 104 degree Fahrenheit, and we will call it very cold when it falls below 32 degree Fahrenheit. And between the range of 80 degree Fahrenheit to 92 degree Fahrenheit, the temperature is considered neutral, right? Now we will see that if the body heat has any relationship with the temperature. Let me tell you that the temperature of an object, that is the measure of the kinetic activity of its molecules, and this is proportional to the amount of the heat which is stored in the object. So we can say that body temperature is directly proportional to the heat in the body. So what is this heat capacity? Or you can call it a specific heat. You see, this is a measurement of the changes in the body heat stores, which are utilized to characterize the temperature regulation quantitatively. Now, this heat capacity, it can be defined as the ratio of heat supplied to the corresponding temperature rise. Or you can also define this specific heat as the ratio of the heat removed to the corresponding temperature fall. And then you can use this formula to calculate the specific heat. You see that body temperature, it increases 1 degree centigrade for each calorie of heat stored per kilogram of body weight, and the specific heat of tissues, that is said to be around 0.83 calorie per kilogram per degree centigrade. Now, I told you that I will introduce you to the concept of thermoneutral zone. This thermoneutral zone is a range of the environmental temperatures in which the body temperature, it can be maintained by adjustment of skin blood flow alone. For a nude human, this thermoneutral zone, it lies between 25 degrees centigrade to 31 degrees centigrade. And we will see increased metabolic rate and vasoconstriction below this thermoneutral zone, while above this thermoneutral zone, sweating will occur. If you look at this figure, which shows the effect of high and low atmospheric temperatures of several hours duration on the internal body core temperature, you can conclude from this graph that in general, a nude person in dry air, which is between 55 degree to 130 degree Fahrenheit, that person is capable of maintaining a normal body core temperature, which will be somewhere between 97 degree to 100 degree Fahrenheit. Look at the heat producing and heat losing factors. Heat producing factors include basal metabolism and some extra metabolism. The basal metabolism, as the name is implying, that is the metabolism of all the cells of body, while the extra metabolism is caused by increased chemical activity of all the cells, for example, in case of fever. And in addition to that, it includes shivering and the muscle contraction, thyroxine and growth hormone, and also epinephrine, norepinephrine, the sympathetic stimulation, even the digestion and absorption of food, that is included in extra metabolism. Uh, if we talk about the heat loss, then you see heat is lost in two steps. That is from body core to the skin and from skin to the atmosphere. You already know that the blood vessels, they are distributed profusely beneath the skin. And especially important is a continuous venous plexus, which is supplied by the inflow of blood from the skin capillaries. Um, and then in most exposed areas of the body, such as in hands and feet and ears, blood is also supplied to the plexus directly from the small arteries through highly muscular arteriovenous anastomosis. So this is how a high rate of skin flow that causes the heat to be conducted from the core to the skin with great efficiency. And in addition to that, blood is very effective in this function because of its high capacity to store heat. And for all these reasons, skin is considered as an effective yet controlled heat radiator system. Now, if you look at this figure, this shows the normal resting tone of the cutaneous blood vessels. And you know that alpha adrenergic receptors, when they are stimulated, then there is contraction of the vascular smooth muscles. So in case of the sympathetic stimulation, which takes place below the ambient temperature of 75 degree Fahrenheit, we see vasoconstriction. And if the ambient temperature that goes above 115 degree Fahrenheit, then we see maximum vasodilation of the cutaneous blood vessels. So you can see that how effective is the skin radiator system, because it shows 8-fold difference in the heat conduction between the maximum dilation and the maximum constriction of the blood vessels. So in short, we can say that skin, it behaves as an effective and controlled heat radiator system, and the flow of the blood to the skin, that is the most effective mechanism for the heat transfer from the body core to the skin. Now I will tell you the basic physics of how heat is lost from the skin surface. You see, there are certain mechanisms through which heat is lost, and these are radiation, conduction, convection, and evaporation. The first three of these mechanisms, they require a temperature gradient to exist between skin and the environment. Now, what is radiation? You see, radiation is a mode by which the heat can be lost from a hot to a cold object in the form of infrared rays. And 60% of total heat loss, that occurs through radiation. And you know that sun transfers its heat to the earth. So we conclude that the radiation, it can also take place in the vacuum. Just like our body, it can also gain heat via the radiation on a hot sunny day. Now, what is conduction? You see, conduction means the loss of heat from the body to the solid objects due to the direct contact. And keep in mind that 3% of body's heat loss that takes place through conduction. But the conduction from the solid objects to the air, that constitutes around 15% of heat loss. Moving on to convection. Convection causes the heat loss by the movement of air. And you should know that whatever heat is lost by the body, it is taken away by the convection currents. So if the surrounding air is cooler than the body, then heat can be lost very easily. Now we will look at a scenario of conduction and convection in when someone is immersed in water. You should know that the specific heat of water, that is far greater. So that means that per unit volume of the water, it can absorb much more amount of heat as compared to the air. In addition to that, the heat conductivity in the water, that is far greater. So as a result, it is impossible to heat the thin layer of water which is next to body. And if the temperature of the water, that is below body temperature, then the heat loss from the body, that is very rapid. And similarly, water's effectiveness in cooling, that is about 25 times greater than that of air at the same temperature. Now, what effect clothing has on this conduction and convection? You should know that clothing can increase the thickness of the private zone of air which is adjacent to skin. So heat loss, it can be reduced by a decreasing rate of conduction and convection, but the effectiveness of clothing in maintaining the body temperature, that is almost completely lost if the clothing becomes wet. Right, so now we move on to evaporation. This is the only way to lose heat when the temperature of the surrounding, that is greater than the temperature of body. And how does evaporation produces cooling? Because for each gram of water or sweat which evaporates, around 0.58 kilocalories, they are lost from the body in the form of heat. And then some heat is being continuously lost by the skin even in the low ambient temperatures, and this loss is called insensible loss. Even a mild evaporation, it continues from the respiratory tract during the process of respiration even. And if we want to know the heat production, then the rate of the heat production at rest is around 1.5 kilocalories per minute, and when someone exercises, it rises to 15 kilocalories per minute. Now, this process of evaporation of the sweat from the skin, this is dependent on certain factors, and these factors are the ambient conditions and the convection currents around the body. Even the amount of the skin, skin surface, that which is exposed to the environment, that also is a factor on which the rate of the sweating, that is dependent. And if we talk about the ambient conditions, that will include the air temperature and the relative humidity. If the relative humidity is high, it will reduce the rate of evaporation, because in this situation, the vapor pressure gradient between the skin and environment, that is reduced. So we can say that if humidity is high, it will limit the sweat evaporation, and if the humidity is low, then this condition is ideal for sweat evaporation and the heat loss. All right. So what is this concept of heat balance? Our body, it achieves heat balance when the rate of heat production, that is exactly equal to the rate of heat lost. So for to achieve this heat balance, our body has got an insulator system and a radiator system. The insulator system, it consists of skin, subcutaneous tissue, and the fat in the subcutaneous tissue, while the radiator system, that is basically the flow of the blood to the skin. You must know that the skin temperature, that is very important in heat transfer to the environment, and the delivery of this heat to the surface, that is blood flow dependent. So to achieve this heat balance, our body has got some effectors which help in altering the body temperature. And these effectors, they include the sweat glands and the smooth muscles around our arterioles, also the skeletal muscles, and some endocrine glands, especially the ones which are releasing thyroxine and epinephrine. Since we are talking about the effectors which alter the body temperature, so why not let's talk about the most important of these effectors, which are the sweat glands. Our autonomic nervous system controls the sweat glands, and specifically cholinergic nerve fibers. They supply these glands. And let me tell you that the primary secretions of these glands, they are rich in electrolytes, but the secondary secretions, they are the secretions in which very little amount of electrolytes is present. Actually, what happens that in an acclimatized person, a person who is acclimatized to hot weather, a very little amount of sodium chloride that is lost in sweat, and that is due to the release of aldosterone, which is responsible for salt and water conservation. In case of lower animals, heat loss by panting is more effective. Because many lower animals, they have very little ability to lose heat from the surfaces of their bodies, because the surfaces, they are usually covered with fur, and also because the skin of most lower animals, that is not supplied with the sweat glands. So substitute mechanism, the panting mechanism, that is used. So what happens in this panting mechanism, that the phenomenon that is turned on by the thermoregulator centers of the brain. How is that achieved? When the blood, it becomes overheated, the hypothalamus, that initiates the signals to decrease the body temperature, and one of these signals that initiate panting. And the actual panting process, that is controlled by a specific panting center in the pons of these lower animals. So I mentioned the mechanism of acclimatization. So now we will see that what happens to the sweating mechanism during the acclimatization. You see that when a person is exposed to hot weather for several weeks, he progressively sweat more and more profusely. You see that at first that person sweats about 1.5 liters per hour, but this rate of sweating, it rises to a double within 10 days, and then it still rises to about 2.5 times as much within 6 weeks. And this change of acclimatization, that is caused by a direct increase in the sweating capability of the sweat glands themselves. The second change which takes place in the acclimatization is the decreased concentration of sodium chloride in the sweat, and that is done for the better conservation of body salts. So as a result, after 4 to 6 weeks of acclimatization, the loss of sodium chloride, it may be as little as 3 to 5 grams per day. Now you might be wondering about the mechanism of sweat secretion. Actually, what happens, which you can see in this figure, that the secretory portion of the sweat gland, this portion secretes a fluid which is called primary secretion or precursor secretion. And then the concentrations of the constituents in the fluid, they are modified as this fluid flows through the duct. Keep in mind that the precursor secretion, that is an active secretory product of the epithelial cells which are lining the coiled portion of the sweat gland. And cholinergic sympathetic nerve fibers, which end on or near the glandular cells, they elicit this secretion. So this is how sweat is secreted. Now let's revise briefly the mechanisms which are used for heat production by our body. The first one is the BMR. So, what is this BMR? It is basically the minimum amount of heat which is produced when a person is physically and mentally relaxed. And this lecture will focus on the abnormalities of temperature regulation. First one is pyrexia, which in common language is called fever. And it refers to increased body temperature above normal. Pyrexia is caused by the toxic substances which can affect temperature regulating centers. So when I say that they affect the centers, it means that in this condition there is a resetting of the set point to a higher level. There could be many causes of fever, among which few are important, such as bacterial and viral infections, as you all know. And then certain environmental conditions and brain tumors, they can also result in pyrexia. Now, we will focus on the mechanism which is responsible for the genesis of fever. Uh, in fact, there is a resetting of the hypothalamic temperature regulation center by the pyrogens. Now, these pyrogens, they are the substances which can raise the hypothalamic set point above normal. And these include not only the certain bacterial viral proteins, but also the breakdown products of proteins. And in addition to that, sometimes the lipopolysaccharide toxins, which are released from the bacterial cell wall, they also act as the pyrogens. Ultimately, these pyrogens, they raise the set point. And when the hypothalamic set point that is raised, then all the mechanisms to raise the body temperature, they become active as well. In this figure, you can see the mechanism of the action of these pyrogens. You see that the pyrogens, either they act directly on the hypothalamic center, or they act indirectly via the cytokines, especially the interleukin 1. What actually happens that there are bacterial breakdown products which are phagocytosed by the leukocytes and the macrophages, and then the cytokines, they are released. And the cytokines, especially the interleukin 1, that is released by the phagocytic cells. And this interleukin 1, it induces the formation of prostaglandin E2. Now this prostaglandin E2, it acts on the hypothalamus to cause the fever reaction. And you must be familiar with the term antipyretics. Now, these antipyretics, they are the drugs which decrease the formation of this prostaglandin E2. For example, aspirin. And this is how they reduce fever. Now, in this figure, you can see that there are two unique features, or you can say two phases of the febrile conditions. Uh, First one is the chills, and the second one, that is called crisis or flush. Now, when the set point that is raised, then the phase of chills that start, in which shivering and vasoconstriction that results into chills in an attempt to raise the body temperature up to the new hypothalamic set point. As far as the second phase is concerned, when the pyrogen that is removed and the set point that is brought back to normal, then all the body mechanisms to lose heat, like sweating and vasodilation, they become active. And as a result of which, the body temperature that is brought back to normal. So, next one is hyperpyrexia, which is a fever of above 41.5 degrees centigrade to or you can say in Fahrenheit, it is around 106 to 107 degree Fahrenheit. And it is seen in severe infections or in case of hemorrhage in the central nervous system. Now, a similar sounding condition is hyperthermia, but keep in mind that it differs from hyperpyrexia because in hyperthermia, the set point, it remains unchanged. So that's why this condition, it does not respond to antipyretics. Then there are different types, or you can say different forms of hyperthermia, such as heat stroke, or it could be drug induced, such as amphetamine or cocaine induced, and it could be malignant hyperthermia also, which is an inherited genetic abnormality in the calcium release in skeletal muscles, where increased release of calcium, it turns on the muscle contractions and excessive heat generation. And sometimes this malignant hyperthermia, this is also triggered by some anesthetic agents such as halothane. Let's look at the disorders due to increased environmental heat. And in order of increasing severity, these disorders could be heat syncope or heat cramps. And then I will give you a brief view of heat exhaustion and heat stroke. There could be a curiosity question to differentiate between heat exhaustion and heat stroke. So let's first move on to heat syncope. Uh, this could be due to history of vigorous physical activity for a couple of hours. Mainly, it results from cutaneous vasodilation, which could result in cerebral and systemic hypotension, leading to syncope. Treatment options of heat syncope include rest in a cool place and fluids given by mouth. Now, what are heat cramps? Due to excessive salts loss in sweat, painful heat cramps they may occur, which of course because they are due to the loss of salts. So these cramps they are relieved by salts, the sodium chloride replacement, and also by the cold environment. Now we next one is heat exhaustion. Uh, this is due to the excessive loss of salts and water, and this excessive loss that leads to hemoconcentration, which will result in hypovolemia and hypotension, of course. And the other symptoms they could be headache, vertigo, nausea, and ultimately the patient collapses because there is less blood supply to the brain. In this exhausting condition, skin is cold and clammy, and the temperature could be normal or subnormal. Treatment options may include the recumbent position of the patient, and the patient should be removed to a cold place and should be given salt and water replacements. Next one is heat stroke, which occurs due to failed compensation. And keep in mind that this is a life-threatening emergency which damages the hypothalamus. And actually what happens that the core temperature, it rises to a point that the hypothalamus, it ceases to function. And a very peculiar sign of heat stroke is the absence of sweating. In heat stroke, the body temperature, it may rise up to 105 to 108 degree Fahrenheit, and there is definitely a failure of all the heat dissipating mechanisms. Usually, heat stroke, it occurs during heat wave when the temperature and the humidity that is very high. Symptoms of heat stroke may include hot and dry skin, dizziness, abdominal distress, vomiting, delirium, loss of reflexes, a loss of consciousness, circulatory shock, hyperpyrexia. And even death could occur due to neuronal damage or renal failure or even myocardial infarction. Now, this heat stroke, this could be of two types. It could either be exertional or non exertional. You see, as the name is indicating, the exertional heat stroke that occurs by exercising at elevated ambient temperatures and elevated humidity. And what could precipitate this condition is dehydration, or if someone is taking medications. Because in case of dry environment and at maximal efficiency, sweating can dissipate around 600 kilocalories per hour, but it requires the production of more than 1 liter of sweat. So you can see that how dehydration can aggravate the condition. Now, the non-exertional type of heat stroke typically occurs in either young or elderly individuals, particularly during the heat waves. Now, more vulnerable patients are the elderly or the bedridden patients, or the patients which are taking say anticholinergic drugs or anti-Parkinsonian drugs, or they are taking diuretics which cause dehydration. And then the individuals which are confined to poorly ventilated and non-air conditioned environments, they are also susceptible to develop this heat stroke. Coming toward the treatment option of heat stroke, they may include the cold sponging or the alcohol swabs, even the ice immersion. This could be a very good idea. And of course, salt infusion that is recommended. Sometimes even skin massage is used to increase the blood flow to get rid of excessive body heat. Now I want you guys to grab a paper and a pen and make a column of differentiation between the heat stroke and heat exhaustion on the basis of their causative conditions, their symptoms, and how do we manage the two conditions separately. I already told you that the cause of heat stroke is the inadequacy, or you can say the failure of heat loss mechanisms. While in case of heat exhaustion, the cause mainly is the excessive fluid loss, which leads to hypovolemia. Then there are certain warning signs. In case of heat stroke, these signs could be headache, weakness, and loss of consciousness. While in exhaustion, the weakness is usually gradual. And a very particular sign is the excessive sweating and anxiety, nausea, and even syncope. So, when we look at the symptoms, especially the appearance of skin, in case of heat stroke, the skin is hot and dry with almost no or very little sweating. And the pulse is usually full, I mean bounding and rapid pulse. And the temperature is very high, usually more than 40 degrees centigrade. If we talk about the exhaustion, then the skin looks pale grayish and clammy. And the pulse is very weak and slow. Also, there is a low blood pressure. And if we talk about the temperature, then temperature is moderately raised, and usually it is less than 40 degrees centigrade. Now, the management is also different in case of stroke or and exhaustion. So, what do we do in heat stroke? There should be emergency cooling of the patient by wrapping or immersion in the cool water. Even ice packs, they could be used over the head, in axilla, or in groin. And the patient should immediately be evacuated to the hospital because it's a life-threatening condition. While in case of exhaustion, the patient should be placed in a recumbent position with his or her feet elevated, and water and salts should be replaced orally. Rarely intravenous replacement is required. Now we will see that how human body reacts when it is exposed to the steroids, antihistamines, and certain vasodilators. Next, localized presentation of hypothermia is frostbite, which is a term which you might have heard in some mountaineer-based movies. Uh, Frostbite occurs when the body is exposed to extremely low temperatures. In other words, the surface area of the body, it can freeze upon exposure to cold, and this phenomenon is called frostbite. Now the question is that how does this frostbite, it could result in permanent damage. Actually, what happens that the ice crystals, they develop in the bloodstream or even inside the cells, causing permanent circulatory and tissue damage. And even upon thawing, gangrene develops, and the area, it has to be removed surgically. Frostbite occurs especially in the lobes of the ears and digits of hands and feet. Now, this figure shows the classification of frostbite. It could be superficial or deep, or you can classify frostbite into first, second, or third degree frostbite. Uh, in first degree frostbite, there is only a slight irritation of skin, while in second degree, blisters, they appear in the skin, but there is no major damage. But in third degree frostbite, this involves all the layers of skin and it causes permanent tissue damage. Now, in this figure, you can see that how pathophysiological changes, they occur in frostbite, and how the ice crystals which are formed in the bloodstream and inside the cells, they damage the vascular endothelium, and ultimately that results in tissue ischemia and skin necrosis. You see, once the crystals are formed, they damage the blood vessels, which will result in the stickiness of blood that will cause the stasis of the blood flow, and very tiny thrombi are formed, and wherever these thrombi, they block the vessels in the skin, they cause then dermal ischemia, and that results in frostbite. Luckily, there is a phenomenon of cold-induced vasodilation, which provides natural protection against frostbite. Now, this mechanism, it helps prevent frostbite by delivering warm blood to the skin. But unluckily, the mechanism is far less developed in humans. Now, in Arctic animals, in which this protective mechanism is very well developed, what happens that when the temperature of the tissues, it falls almost to freezing, the vascular smooth muscles, they become paralyzed due to extreme cold, and because of this paralysis, sudden vasodilation occurs, which is manifested by the flush of the skin. Now, this vasodilation, it leads to the improved blood supply to the tissues, and it helps against the frostbite. Sometimes hypothermia could be used for medical science advantage also, such as the artificial hypothermia, in which the temperature of a person is decreased by the use of ice or cooling blankets until the temperature falls. Now, this temperature can be maintained below 90 degree Fahrenheit for several days to a week or more by continual sprinkling of cool water or alcohol on the body. It is easy to decrease the temperature by first administering strong sedatives which reduce the reactivity of hypothalamic center. Now, what is the use of this artificial hypothermia? You see, heart surgery